Hello, my anatomists. Welcome to lesson 3, which is all about disease. Before we dive into this lesson, just a little reminder that on Monday, October 17th, you are going to have your quiz number 2. That's going to cover lessons 1 to 3. Most of the information will be from lessons 2, which is homeostasis, and lesson 3, which is disease, which you're going to learn about today. But I put 1 through 3 because lesson 1 material and those medical terminologies are fair game. So in today's lesson, we are going to answer the essential questions. How do professionals diagnose and describe diseases? And why do we get sick? But before we dive into our notes, we're going to play a little game called Fact versus Myth. I'm going to show you 5 statements about disease, and you have to decide whether the statement is a fact or a myth. I'm obviously not there to be able to see whether you have a thumbs up or a thumbs down, but feel free to talk to somebody around you if you would like to discuss whether you think it's a fact or a myth. You can pause in between each of the statements and see how many you get right. This is not collected. This is not going to be scored in any way. So there's no point in Googling what the answers are because I'm going to just run through all of these. So state number 1, you catch a cold by going out in cold weather with wet hair. So if you said that was a myth, nice work. It is a myth. In order to get sick, like to catch a cold or to get the flu or to get COVID, for example, you have to come in contact with a virus or bacteria. So going outside with wet hair, that's not a cold, that's not a virus, that's not a bacteria, that's not something that can contaminate your body. So no, you cannot catch a cold by just going out in cold weather with wet hair. Your hair can freeze though, and then break off like little twigs breaking, which I do not recommend. Next statement, eating raw cookie dough can make you sick. So if you said that was a fact, nice job. Eating raw cookie dough can in fact make you sick. A lot of students think that it's because of the raw eggs that are in the cookie dough. However, the raw flour is what's actually more dangerous. Flour that you have in your kitchen has not been treated in any way. It hasn't been heated to a high temperature. It hasn't been bleached. Nothing really has been done to it in order to eliminate bacteria like E. coli. And so eating raw flour is very dangerous because you could get very, very sick from it. So you're more likely to get sick from the raw flour than you are to get sick from the raw egg. Regardless, if you are big into cookie dough, raw cookie dough, you are welcome to look up some recipes where they do have safe raw cookie dough for you to make. Eating too much sugar causes diabetes. If you said that was a myth, nice job. It is partially true. So diabetes has a genetic component, but it needs to have a trigger as well to kind of kick that gene on, to turn it on in your genetics. And so you have to have the gene for diabetes in order for you to become diabetic. And so if you do carry that gene and you eat too much sugar, yes, you could turn that gene on, you could trigger it on, and then you would become diabetic. But if you don't have that genetic component, then you could, in theory, eat a lot more sugar and not become diabetic, but you might become a little heavier, and that might not be very healthy for you to do as well. So too much sugar is not great regardless of the situation. We get fevers because high temperatures kill off bacteria. If you said that was a myth, nice work. There's a very, very, very small truth to that. Fevers will make bacteria and viruses more uncomfortable and make it a little bit more difficult for them to survive, but it definitely does not kill them. Fevers, what it does is a fever raises the alarm. It's kind of like the fire drill bell, and it raises the alarm and it says, hey, immune system, you got to get started shooting out those those white blood cells into our blood because something has attacked our body, and we need to get to work to kill this bacteria, this virus, whatever it might be. So it's the alarm bells for our body. Sickle cell anemia makes a person immune to malaria. That is a fact. So that is one of the consequences of having sickle cell anemia. There are some far more negative consequences. The fact A sickle cell anemia is when your blood cells are deformed, and instead of being kind of like donuts, like little circular objects, they're sickled. So that looks like a crescent moon. And so those really sharp points on the ends of the red blood cell make them more likely to break, make them way more fragile, and way more likely to damage your veins and your capillaries and things. So sickle cell anemia is a very dangerous condition, but it has been treated very well medically. So let's look at lesson 3, which is all about disease. We're going to start with health and disease. So when diagnosing or describing diseases, which we can also call disorders, we often first look for the signs and symptoms of the patient that indicate an abnormality in their health. So you've probably heard that terminology, signs and symptoms. They always go together, but what exactly is a sign versus a symptom? So a sign is something that's objective, meaning that there's no personal involvement in it, meaning that it can be seen or measured by someone else. So perfect example of this would be temperature, heart rate, blood pressure. Those can all be measured. We've got the tools to measure them. Things that can be seen: rashes, swelling, obvious deformation of a limb. Those can all be seen by an outside observer, so all of those would be signs. A symptom is subjective, so that really depends on the patient. Means that it can only be felt by that patient. A perfect example of this is pain. We all have very different pain thresholds, and there's no way for me to compare what's painful to you versus painful to me. And I can't discount that if for you, you're saying it's the most painful thing you've ever experienced. I can't say, no, that's not true, right? Because only you can know what is most painful for you. So things like pain, things like how tired you are, all of those things are more subjective and they depend on the person themselves. A syndrome is a specific set of signs and symptoms that occur together but may have a different cause between patients. Okay, so toxic shock syndrome is a very good example of this. So, when developing a diagnosis, medical professionals often look at different risk factors that exist within a patient's life that might increase the possibility of disease. These factors can be organized into 6 major categories. So, if you've gone to your primary care physician and your doctor has asked what your family history is, that is in order to develop risk factors. They also ask you, when you're an adult, they'll ask you things like what your occupation is. If you smoke, a bunch of different other questions, and those are asked of you so that your doctor can determine what your risk factors are. So here are the top. We're going to do the top 3 and then the bottom 3. So the first one is going to be a genetic factor. So those are most commonly referred to as family history. If you have a family history of breast cancer, then that makes you more likely to have breast cancer, for example. Age. If you are significantly older, you are much more likely to get diagnosed with something like pneumonia after having a common cold than when you're much younger. Your body just ages differently. Your immune system is not as effective when you're 98 years old than when you are 16. So people vary from each other at different ages biologically. Lifestyle, the way people live and work. If you are staying up all night, if you're not getting good sleep, you are not feeding yourself well, you are just downing monster energy drinks all day, every day, all of those things will have an impact on your body and how well your body is functioning. So that is a risk factor for things like heart attacks, for example. Stress. Stress is a huge one. Stress can have very physical demonstrations on your body. So, physical, emotional, and psychological stress are all factors that can physically impact your health. So like a perfect example of this is like in The Notebook, right? When when the couple is like old and dies together at the end, that emotional distress will physically, like that feeling of being brokenhearted, that is a physical response. Your body is physically hurting, which is pretty crazy that your brain and your emotions can demonstrate a very physical reaction. Environment, a person's climate, geography, pollution, or social status. So if you are of lower social status, let's say that you have a tough time finding regular housing, that'll put you at much higher risk factors for certain diseases like Hep C. That's a very common one that the homeless population has. Another one, like your climate or geography, you're most likely not going to be looked at for malaria in the United States, but you might be looked at for malaria in Central America, in certain African countries. So, depending on your geography, it'll determine what diseases are present where. And then pre-existing conditions. So having one disease can often lead to a secondary disease. So those are often called comorbidities. So if you for example, have a heart valve transplant, you're more likely to have a heart attack or a stroke post surgery. That's just one of the risks that you are taking from having this pre-existing condition. So, once a diagnosis has been made, a medical professional will generally provide a prognosis to the patient as well. So, your prognosis is going to be how well you are to be cured, what kind of the plan of attack is going to be. If a disease develops quickly and persists for a short time, it's called an acute condition. So, a good example of this would be a broken bone. It happens very quickly. You slip, you fall, you break a bone. It persists for a short time. You might be in a cast or a boot for 6 to 8 weeks, which to you might seem like forever, but in terms of your lifetime, that's a very short time. So that would be considered an acute condition. However, if the disease develops slowly and persists for a long time, it's called a chronic condition. So that's things like arthritis. Arthritis takes a long time to develop. You'll slowly start feeling a little bit of aching, and then it'll get worse and worse. And once you have arthritis, it doesn't ever really go away, and it'll last for the rest of your life. So we would consider that a chronic condition. However, there are some diseases that can go into remission, which means that they kind of subside and they fade into the background. That does not mean that you are cured of this disease. It just means that it is not physically being demonstrated in your body currently. So let's talk about our mechanisms of disease. And that's the last section for our notes for lesson 3. And then we'll tackle our vocabulary. So, mechanisms of disease. There are very, very many different ways a disease could be caused. To simplify it, we can use these 9 general mechanisms. A key detail about these mechanisms is that they're not mutually exclusive. So that means that they can and often are combined. You'll often have more than one mechanism of disease to trigger a specific illness. Okay? So the first one that we're going to look at is degeneration. That's when the body degenerates, it breaks down. This is a normal part of aging, but it happens with some diseases as a result of other mechanisms. So, for example, MS is multiple sclerosis is a good example of degeneration where your body is breaking down at a much faster pace than it should. And so that is actually triggered by a different mechanism, which is actually a genetic mechanism. Autoimmunity, that's when your immune system gets confused and it attacks healthy body tissues for so many different reasons. There's a lot of autoimmune disorders that we do not comprehend at all. We don't understand how they are triggered or what can trigger them. A big autoimmune response is getting hives. And if you go to an allergist, they'll often tell you that we're not 100% sure why we develop allergies. For example, when I was in college, I got allergies randomly my sophomore year. I went to an allergist. He was like, "Hey, you've never been allergic to anything before. Take some like Benadryl every day for a year and then stop taking it." And I used to get hives every single time I ate any piece of food. And then I took Benadryl every day for a year, stopped taking it, never got hives again. What was the reasoning? We have no idea. So that's a weird one. Metabolic. It's any form of malnutrition or endocrine dysfunction. So remember we talked about our thyroid. That would fall hypo and hyperthyroidism would fall under metabolic. It could also be things like low vitamin D. That is a form of malnutrition. That doesn't mean that you are malnourished. That just means that you're not receiving enough vitamin D. That is a very common issue for a lot of women. Like I have low vitamin D. That doesn't mean that I am not feeding myself or I like can't eat. It just means that I have not consumed enough vitamin D or my body is not good at holding on to enough vitamin D from my foods. So you can always supplement those with supplements that you can get at like any store, basically. Well, like any grocery store or pharmacy. The next one is inflammation. So that is when the body's normal inflammatory response is abnormal or lasts too long. So we've all had inflammation. You'll get some inflammation around like cuts sometimes. Or if you've sprained an ankle or a knee or an elbow, if you sprain something, you'll see that there's a huge inflammatory response. Idiopathic means that we have no idea what's going on. The way that I like to remember idiopathic, because that's kind of a weird word that we never really hear, is it kind of sounds like the beginning kind of sounds like idiot. And an idiot has no idea what's going on. So idiopathic, the cause is unknown. Okay, I'm not calling doctors idiots. I'm just saying that's a good little mnemonic for you to try to remember idiopathic unknown. Okay. Neoplastic. So neoplasms are abnormal tissue growths, which are also called tumors or cancer. Okay. Then we've got a genetic factor. So an altered or mutated gene causes the production of abnormal proteins or no production at all. This results in loss of function in the body. A major genetic disease is Huntington's disease. And it is genetic. And if you have a parent with Huntington's, you have a 50-50 chance of getting Huntington's yourself. And so a lot of people will choose to either get tested or not for it because some people want to know if their lifespan is going to be shortened dramatically or if it's not. And some people want to be able to plan for that. And some people are just decide that they're going to live their lives and see what happens. But there is a test for you to determine whether or not you are a carrier of Huntington's. But you would definitely know, like you would have to have a parent who has Huntington's for you to carry that gene. Infectious. I think we are all tired about talking about infectious diseases after COVID and 2020 onwards. So we know we're very familiar with infectious diseases. It's any disease caused by damage from a pathogen, and it can be transmitted between people. This could be bacterial, viral, fungal infections, as well as parasites. So your cold, your flu, athlete's foot, that is a fungal infection. It is prevalent in a lot of locker rooms. I'm sure a lot of our student athletes have had athlete's foot at some point. And then same thing, parasites. Traumatic is any physical, chemical, environmental, or mechanical agent that affects homeostasis somehow. Breaking an arm, physical trauma. Super dehydration, chemical trauma. That is also environmental trauma. Chemical trauma could also be things like getting bit by a snake. That toxin could be chemical trauma. Mechanical, like getting your arm crushed under a boulder. All of those things your body would not enjoy. It is not in happy homeostasis, and so it is no good. It is a traumatic injury. Okay? Vocabulary. We have diagnosis. Diagnosis is the identification of the nature of an illness by examination of signs and symptoms. Disease, an abnormality in the structure or function of the body. Health. Health could be mental, physical, emotional, and social well-being as well. Health, we've found out, especially during lockdown, during COVID, that social well-being is a huge component of health. We are gregarious species, which means that we like to hang out with other people. We like to be in groups. And so social well-being is very important. Idiopathic disease, that's our little idiot joke. It means it is a disease with an undetermined or unknown cause. And finally, inflammatory response. It is a localized condition in which a body part becomes reddened, swollen, hot, and painful. You often will feel that like throbbing sensation in your inflammatory response. It almost feels like the spot that's inflamed has its own heartbeat. We have mechanisms: mutually exclusive, neoplasm, remission, and risk factor. So lots lots of vocab words today. So mechanism, it's the way that something happens. Mutually exclusive, it means that two things cannot occur at the same time. Neoplasm is a new or abnormal growth or a tumor. Remission means temporary recovery. And risk factor means something that increases the likelihood of a disease happening. Now, you are going to need a piece of loose leaf paper in order to complete this next activity. You are going to turn this into your substitute teacher. So, if you do not have a sheet of loose leaf paper, your substitute teacher can hand you one, or one of your classmates can hand you one. I'm going to present 3 short stories about patients. They're also called vignettes. And you're going to have to pick out specific information from the stories and or diagnose the mechanisms of disease. So it's going to make a lot more sense when we look at our first one. I'm going to read through all 3. Feel free to pause, read them on your own, pause to answer your question, rewind, whatever you need to do in order to answer these questions. So for this first vignette, I want you to write down for me, what are the signs? What are the symptoms? What are the risk factors? And what is the mechanism of disease? So those are the 4 things that are at the bottom of your screen in that blue rectangle. Okay, so signs, symptoms, risk factors, mechanism. So let's read our first story. We have Adam. He's an HIV patient. He has developed a high fever of 103.4 degrees Fahrenheit. He has difficulty breathing. He has a persistent cough, chest pain, fatigue, and muscle aches. When he goes to the doctors, he's sent to receive a chest x-ray, which shows a cloudiness in the right lung. Adam's diagnosis is fungal pneumonia, which is a type of lung infection. So you can pause right here, answer those questions, and then we'll move on to our second vignette. So clinical vignette number 2. In this one, I would like for you to find the signs, the symptoms, the risk factors, and the mechanism of disease. So once again, those are the 4 things that are in the blue rectangle at the bottom of your screen. Those are signs, symptoms, risk factors, mechanisms. So story number 2. Madame Curie, I know her name is Marie, but also Madame, because that's like how you say ma'am in French, right? Is famous for her work with radioactive elements. She died from leukemia that was probably caused by a long exposure to high levels of radiation. Signs and symptoms of leukemia include easy bleeding or bruising, pale skin, weakness and fatigue, bone or joint pain, and frequent infections. Okay, and story number 3. In this one, I just want you to outline what the risk factors are and what the mechanism of disease is. Okay, so risk factors, mechanism of disease. In the last decade, many former professional football players and their families have come forward describing severe neurological issues affecting their lives. The autopsies of these athletes showed a breakdown and loss of brain tissue. Medical professionals now recognize that repeated head injuries and concussions associated with contact sports can eventually lead to developing the disease. And this is actually a very relevant story. I know nothing about sportsing, but I do know that in the news, major headlines was when a professional football player, don't know his name or the team he belongs in, his like uniform is white and green, maybe? I don't know. Anyway, this gentleman was playing. He was tackled, he was hit in the head, he was diagnosed with a concussion. And because we are not entirely sure why, there's an entire investigation going on because the NFL has gotten a lot of trouble for how they deal with concussions with their players. He was allowed to play the very next game, and during that next game he was tackled so hard. He was carried out off the field on a stretcher. He is being treated for a very severe concussion to the point that they have diagnosed him with a traumatic brain injury, which is life altering. It can very much change your personality, your mood. Your brain is a very, very essential part of your body. So please, 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 all of my student athletes, especially my football players, please watch your brains, let your brains develop, and try to take those tackles appropriately. I know that your coach teaches you guys how to do it. I know that there are freak accidents, but it's always terrifying seeing people getting tackled. So that's my little mom parentheses. That's it for those three vignettes. So after all this blah blah, you should have had enough time to write down all of the answers that you need to write down. So at this point, you're going to turn in your loose leaf paper to your substitute teacher. And then you are going to, oh no, I lied to you. There's a fourth vignette. I'm so sorry. Okay. You can do this one if you'd like. If you missed it, there are 5 of them. Oh, I'm terrible at this. You can skip 4 and 5 if you don't want to do them. I'm very sorry. This is very embarrassing. Okay. So, clinical vignette number 4. We're going to do signs, symptoms, mechanisms. So, there was a pathologist convention in Houston, Texas, in which hundreds attended. On the second day of the convention, about 1/3 of the individuals began to exhibit the following signs and symptoms. There was vomiting, headaches, dizziness, chills, and fatigue. Medical officials evaluated the cases and determined that all were suffering from salmonella food poisoning. Bummer. So we want signs, symptoms, and mechanism. Okay, number 5. I'm so sorry. We're looking at signs, symptoms, and mechanisms. A 7-year-old boy presents with fever, sore throat, runny nose, and fatigue. Physical examination reveals multiple bruises of his lower extremities and arms, a redness of the pharynx with white patches on the tonsils, and pale gums, lips, and nail beds. During his stay at the hospital, the patient's pharyngitis was monitored and subsided. Subsided means it went down. Tonsillitis was ruled out. Lab results show high white blood cell counts. A bone marrow biopsy confirms the diagnosis as white blood cell malignancy. So, signs, symptoms, and mechanisms. Now that you're for real done with these stories, feel free to go ahead and complete question set for lesson 3 on disease. You are going to complete all of question set 3. So that is going to be questions 1, 2, 3, and 4. So that's 2 sheets of paper. There is a stapler on my desk. So if you finished your question set and you want to tear that out of your packet, staple it, and give it to the substitute teacher, you are welcome to do that. One last friendly reminder, your quiz is on Monday, October 17th. Once again, so sorry about the little story mix-up, and I will see you on Monday. Hope you guys have a wonderful weekend, and I will see you soon and very soon. Make good choices. Bye-bye.